Hello everyone, my name is Dr. Pradeep Shinoy from Pacespro. I'm your instructor for MRCP Part 1 exams. So today I'm going to discuss about MRCP Part 1 preparation. As all of you are aware, MRCP exam consists of three steps. There's MRCP Part 1, which is a written exam where you need to answer the best of 5 format questions. Then you have MRCP Part 2 written, which once again an written exam on how to answer these questions with best of 5 format. Then you have PACES, which is a practical exam where you have interaction with patients, where we need to demonstrate your clinical and communication skills. Today, I'll be limiting myself to MRCP Part 1 preparation. As you can see from the slides, the Part 1 contents are quite vast and they include broader subjects such as cardiology, neurology, nephrology, and oncology. So most of these major subjects have a question limiting from 14 to 15 questions out of the 200 questions. However, the biggest one is the clinical science, which constitutes about 25 questions out of 200. And clinical sciences includes cell and molecular biology, clinical anatomy, biochemistry, clinical physiology, genetics, immunology, and statistics. So it's quite a vast array of topics which needs to be covered under clinical sciences, and you get the maximum number of questions in this subject. So let us understand how we can prepare ourselves better to face the Part 1 exam. To begin, we have various options ranging from textbook to online platforms. To begin, what about textbooks? The simple answer is no to textbooks because textbooks are quite vast, and if you start reading them, you may not be able to finish those textbooks in 3 to 6 months' time. So, definitely, I will recommend textbook only to those topics which you need to know in little more in depth, or those are frequently appearing in exam. For example, if you consider the topic on infectious diseases, HIV and malaria are the major questions on those topics. So I would recommend to go to the textbooks on those topics which are quite important, or you need to understand those topics in a little more detail. However, if you, I would definitely not recommend going through from the first to page to last page of the textbooks. Next options will be notes. Notes are quite good, they're quite crisp, and once you go to the notes, you know what area to focus on, what are the important questions, and they will give you a gist of the overall preparation of MRCP part exam. However, the drawback of the notes is that you may not understand the concept, you may not understand the basic pathophysiology, or you may not be able to remember those notes because they are quite vast and extensive. However, notes are quite important in terms that you can revise them when you have prepared going through your questions. So definitely you can go through notes just before your exam. What about question banks? Question banks are the way to go. So you need to read the question banks, whichever book you want to read. Question bank are will give an overall idea of what topics are important and which area about those subjects you need to concentrate. For example, if you want to go through malaria, I would definitely be focusing more on the treatment aspect of malaria, even for part one exam, because a lot of questions are on the drugs which are used in malaria. Next, into the online platforms. Online platforms are quite good, and they range in content from small to big. So I would definitely check how much time you have before going through those online content. As you know, one of the online platforms is quite vast, and you might require about 6 months time to go through these topics individually. So I would definitely go through the platforms, knowing how much time I have left for before the exam. But I would definitely recommend going through one of the online platforms which are available in the website. So how to answer these questions? You know, the questions are quite vast and there are 200 questions. I need to answer all of them as there are no negative markings. So we need to prepare very well. We need to go through these subjects predominantly questions once, twice or thrice if the time is available. Definitely knowing the previous questions or the past questions will definitely help you to prepare well and answer these questions. And next idea will be to read the options first. As you know, these are scenario based questions, and clinical questions range in go on through multiple sentences, so you don't know what you need to really focus on when you go through these questions. So I would recommend you need to go through the answers first to find out what they want you to answer. Is it about the investigation? Is it about the diagnosis? Is it about the treatment? Or are they asking just about one pathology or pathophysiology or a function of the some gene? So you need to know when you go to the STEM what really you need to focus on reading them. And few of the options such as seen only or always may not be true. As you know, in medicine nothing is exclusive, so you need to focus on the things. So such answers may not be right most of the time. I need to answer all the questions, and there is no negative marking. So if you lose out on even on 5 or 10 questions, you're going to lose out on your pass percentage. So you need to finish and time your answer well, so that you can attempt all the questions. Time management is quite critical, and giving a mock exam will definitely help you to improve your time management. One of the other option, when you go to these questions, actually about 5 to 10% of questions are really tough. You may not be able to answer them. About 3 to of the 5 or best options you may not be able to understand. So I would definitely leave those difficult questions at the end, so that I have enough time left to answer those questions at the end, rather than wasting the time in between. And if the question appears too easy, I would definitely think twice before answering, because these easy questions are usually tricky. So you need to go through them twice. Whether is it so simple? Generally, the level of MRCP questions are about moderate to average. And whenever you go to the answers, best of 5 possibility, you need to answer the best which is among the 5. So which may not be true always. For example, if a patient is presenting with altered mental status and a focal neurological deficit, the best investigation would be to do an neuroimaging. Either a CT brain will be more preferred over an MRI. However, if you ask about what is the first investigation, definitely I would check their blood glucose level and or electrolyte level, so that we need to rule out those simple, treatable, reversible condition. So you need to see what the question is really about. Is it about the first investigation, or is it about the best test among those? So you need to choose what is the best option among the 5, rather than the correct answer for the question. And passing is based on the pre-designed marking, so we'll not go much into the details. As your we should really focus ourselves on how best we can prepare for part 1, and how we can pass the exam, rather than looking into the intricacy of marking. I think that's it from my side for the part 1 preparation course. We at Pacespro offer courses both online and offline for part 1 preparation. If you would like to join us, definitely you can contact on those details which are available in the slides. So once again, thanks everyone.